Welcome, everybody. I want to take a quick moment to thank you all for joining us from your busy day, whether it's morning or afternoon or evening, wherever you're calling in from, for the first of our mental health webinar series in 2023. We do appreciate you taking the time to be here today. Before we get started, I just wanted to share that, as I mentioned, this is the first of a series of mental health webinars that GRNEN is going to be focusing on over the next few months. As we look to what is one of the most critical topics based on feedback that we've received from our community, we understand that mental health as it relates to our rural communities, rural nurses, nursing students, is one of the most important topics that we can be discussing today. So we wanted to take the time to put a lens on that and bring together a few really important conversations. In addition to that, we are going to be hosting Patricia Gilley on May 12th. This is an excellent opportunity for students. Patricia is a rural nurse living and working in Rockingham County, North Carolina in the United States. And she has graciously offered to host a Q&A where students, or really anybody who's looking to get insights on what it's like to live and work in a rural community, can ask questions. All of this information can be found directly on our website along with registrations at grnen.org. And then just a little housekeeping, we are going to be accepting questions throughout the course of the webinar. You can feel free to use the Q&A feature or the chat box, whichever is easier for you. But please note, we are going to hold all of our questions until the end. We will leave plenty of time for Q&A, but please feel free to pop your question in whenever it's convenient for you. I would like to welcome Dr. Suzie Bartlett, our presenter for today. Dr. Bartlett is the principal lecturer in the School of Nursing at Otago Polytechnic in Dunedin, New Zealand. She has 17 years experience working as a clinical nurse in acute care, primary care, and mental health before joining Otago Polytechnic, where she has been a mental health nurse educator for the last 11 years. Suzie completed her Doctor of Professional Practice in February 2022. Her research was on tertiary learner mental health and well-being and the development of a national framework. Suzie has published journal articles nationally and internationally in relation to the mental health of tertiary learners, disrupted learning during the COVID-19 pandemic, and the merits of mental health simulation and nursing education. So I would like to welcome Dr. Bartlett as she presents her presentation on tertiary learner mental health, the development of a national framework. Go ahead and turn those controls right over to you.
All right, does that come up?
Yes, you're perfect.
Okay, perfect. Right, thank you very much, Stacey, for your lovely introduction, and to the GRNEN for the invitation to share my doctoral research with everyone today. Good morning to everybody, or good evening, depending on where you are in the world, and thank you very much for giving me your time today and listening to this presentation. It's currently just after 8 o'clock in New Zealand in the morning, and I realise that it might be late for some of you in other countries, so I do appreciate you joining me, and welcome to this presentation. So before I start, I'd like to firstly acknowledge and thank the participants in the research study, because without their stories and valuable insights, this work would never have come to fruition. I'd also like to thank the leadership team at Te Pukenga Otago Polytech, who have engaged with this research and really supported it from the very beginning. And also the Safe-Minded Mental Health Accreditation team that supported me in undertaking the accreditation process for Te Pukenga Otago Polytech as well. So as Stacey said, my name's Suzie Bartlett, and I'm a principal lecturer and the research coordinator in the School of Nursing at Te Pukenga Otago Polytechnic. And in New Zealand, currently, all of the polytechs and vocational education providers have joined together as one entity, and we're known as Te Pukenga. So I'm presenting to you today from Te Pukenga, Otago Polytechnic in Dunedin, which is in the deep south of New Zealand, down where this big red dot is here. But I will refer to the entity that I work for simply as Otago Polytechnic in this presentation, just to avoid confusion. So across Otago Polytechnic campuses, there are approximately 10,000 students enrolled in tertiary study and around 800 staff. This photo is of the main block of the Dunedin campus, and the nursing school is located here on the first floor. And this area down the bottom here that's all lit up is known as the hub, and I'll refer to that later on in the presentation. It's a very communal area where students and staff can come together to share food and gather. So briefly, what we're going to cover in this presentation. Firstly, I have integrated Mary moments throughout this presentation. So Mary moments to me demonstrate pivotal learning points in my doctoral journey. Mary is a pseudonym used to maintain student confidentiality, but Mary does represent real experiences that I have encountered with students in my professional practice role. So Mary moments were included in my doctoral thesis at the commencement of each chapter, and they told the story of the problem, the motivation of the research, and the doctoral journey right through to developing a solution. I will talk about the problem that primarily became the motivation for undertaking this research, and then I'll discuss the purpose of the research and what new knowledge that I have gained throughout that. I'll also introduce a solution that was developed as a result of the doctoral research, and that's the Safe-Minded Mental Health Accreditation Framework. I will briefly talk about the purpose of the framework and then finally look at the next steps in the positive change that has already taken place as a result of the implementation of this framework. So this is the first Mary moment, and this Mary moment opens my doctoral thesis. I felt it was really fitting to start this presentation with it also because it has been the absolute foundation of this research study. So here we go. The phone rang. It was the local mental health service where I had a nursing student, Mary, stationed on clinical placement. Please, you need to come now, straight away. There is a problem with Mary. So upon entry to the mental health service, I saw Mary curled up on the floor in the hallway, and she was so distressed in her own mind that she was actually unable to cope. And I wondered at that moment if through academic study, we were actually making learners more unwell. So seeing this distress was a pivotal moment in my professional practice, and it was this moment with Mary that became my motivation for change. Upon reflection, it was this moment with this distressed learner that actually sparked the beginning of my doctoral journey. So I have taught mental health and addictions papers in the Bachelor of Nursing degree at Otago Polytechnic for the last 11 years. And during this time, I've noticed more and more students presenting with poor mental health within the nursing faculty, and Mary was one such student. In the first few years that I was teaching nursing students, I supported approximately 2 students per year with poor mental health. And over the last 10 years, that number has risen to about 40 students per year, which is about 30% of our entire second-year student cohort. So these numbers were also reflective of the experiences that the student support staff at Otago Polytechnic were experiencing as well, and the table demonstrates this. It also is reflective of the experiences of staff across all faculties and departments within the organisation. So in 2017, 276 students presented to the student support services with poor mental health that was actually affecting their study. In 2018, this rose to 559 students, and then it rose again to 685 students presenting with poor mental health prior to October in 2019. So these statistics here show a significant yearly rise in the students that were accessing student support services. And it's important to note that these statistics shown are actually pre-COVID, as the data collection for this research was undertaken just before the COVID-19 pandemic hit New Zealand. This does, however, identify that there were escalating numbers of tertiary learners presenting with poor mental health before COVID. Research shows that COVID has contributed to the declining mental health of students while they undertake academic studies. So these statistics, I imagine, would be heightened even further now. Mary is not alone. It seemed that now I was also not alone. I have come to understand that other people in my organisation were confronted with Mary also. Other people were seeing it too. The initial motivation to undertake this work came from witnessing the heightened number of tertiary learners presenting to lecturers in the nursing school with poor mental health, or in varying degrees of mental distress, and also the increase in compassionate withdrawals from learners due to poor mental health. So compassionate withdrawals refer to those learners who withdraw from their chosen course of study, either altogether and they don't return, or they take some time out from study before re-enrolling due to a decline in their mental health. From having conversations with colleagues across other faculties at Otago Polytechnic, it became evident very quickly that we were all experiencing a similar phenomenon in relation to the increase in poor mental health among our learners. Because there were many people across our organisation that were concerned about the increase in numbers of learners with mental distress, we actually banded together and developed the Mental Health and Wellbeing Advisory Group. And this group took about 12 months to formalise, getting approval from leadership within the organisation. It was surprising actually that so many individuals joined this group from all faculties, and it was a way to discuss and implement mental health initiatives to better support our students. Through this group, though, there were some initiatives that came to fruition, but it did identify to me that a larger research project was needed to be undertaken to hear the voices of colleagues working in tertiary education to better understand what we were actually facing in regards to mentally distressed students. I thought that in order for one person to make a systems change in such a large organisation, that undertaking doctoral research would provide enough traction to actually see this through. So I want to acknowledge that many students have good mental health while they're studying, but the focus of my research was on those students who have a decline in their mental health while they undertake study. According to the World Health Organization, statistically, poor mental health is evident in 1 in 5 people, but through this research study, it became evident that 1 in 3 students will experience poor mental health while they undertake study. So the purpose of this research was to investigate 4 questions. The first one is, what is the impact of tertiary study on mental health and wellbeing of tertiary learners? The second question is, are tertiary institutions alleviating or contributing to poor mental health in learners? Thirdly, what is the importance of developing academic resilience in tertiary learners? And lastly, how do we embed mental health and wellbeing into policy and strategy to develop a new way of thinking? The actual research process itself, I used autoethnography and ethnography as methodology. Semi-structured interviews were undertaken with 23 participants across 2 different data sets. So both data sets were qualitative. Data set 1 was made up of regional participants at Otago Polytechnic, and data set 2 was a national participant cohort from 6 different tertiary providers across New Zealand. Both the regional and the national participants were included because I wanted to understand if what was happening in Otago was echoed nationally across other polytechnics as well. I also interviewed academic staff as well as non-academic staff, and they were both included in the study because they both interface with learners on a daily basis. But I wanted to see if there was differences or similarities in their experiences. I used thematic analysis to generate themes within the data, and 3 overarching themes were identified: resilience, mental ill health, and environment. Mental ill health is an umbrella term that is inclusive of both mental illness and poor mental health. So these three main themes, along with consideration of practice gaps identified throughout the research study, underpin the development of the Safe-Minded Mental Health Accreditation Framework. And this framework was created as a direct response to the findings in this research study. So therefore, it is an evidence-based framework. So what contributed to Mary's thinking? I'll now look at some of the highlights of the research findings to identify some of the contributing factors to poor mental health in the student population. So the escalation in presentations of learners to student support services and academics are not only a result of a larger learner population than ever before, but also an increase in poor mental health in learners. But on a positive note, there has also been a decrease in the stigma and surrounding mental health in the tertiary learning environment in New Zealand as well. There's also a correlation between the age of students entering tertiary study and the age of onset of some of the major mental disorders also. So that might be a contributing factor to an increase in student presentation to the support services with deteriorating mental health. To add some insights to the first research question underpinning this study, what is the impact of tertiary study on mental health and wellbeing of tertiary learners? I'll briefly summarise some of the findings. So the combined data sets showed external pressures contributed to poor mental health in the tertiary learner population. And these external pressures included pre-existing anxiety or depression prior to coming into tertiary study, financial stresses, having to work as well as study, high academic workloads, including assessments and the academic pressures associated with those assessments, relationship difficulties. Leaving home as well was a big one, and that was because there was a lack of connection for students to their family and friends. Also challenging home environments and social media as well. So the added pressure of academic study on top of pre-existing poor mental health appeared to be a risk factor for further deterioration in the mental health of learners. So it could be that academic study and the pressure associated with academic study is enough to exacerbate symptoms of poor mental health. So therefore, in relation to the research question, are we making tertiary learners sicker through academic study? The data sets indicate that, in fact, this could be the case. It was found that learners with good mental health support do better than those learners who don't access mental health support when needed, which is what would be expected. Poor mental health was found to impact learner attendance, and that when learners were mentally unwell, they did have a lot more difficulty actually coming to class. I also found that it is often the learners that need help the most that don't present to the support services. And there are some barriers to seeking help for learners, and some of these were identified, such as the lack of after-hours pastoral support at Otago Polytechnic. And at times there were long wait times for students trying to access support. And the long wait times in accessing support was reported as a national issue for learners. That wasn't just something that was found at Otago Polytechnic. And that was mainly due to under-resourcing of mental health support staff. The physical environment was also seen as key, and if the support services are not in a place where the learners feel safe to present due to a lack of privacy or anonymity, then that can be a substantial barrier to learners coming forward and seeking help. The research also found that lawnmower parenting and the secondary schooling system in New Zealand has not allowed teenagers to have experiences that are inoculating them to develop resilience. Lawnmower parenting is named after that machine we use for cutting the grass, the lawnmower. And a lawnmower parent will literally mow down any obstacle their child might experience and rush ahead and intervene, saving the child from any potential discomfort or problem. So therefore not exposing them to facing adversity, which is where we can develop resilience. And it has been reported in the literature that facing adversity in your formative years and throughout early adulthood can have an inoculating effect and that can help to develop resilience. And Martin and Marsh have published quite widely on that. The data described parents who drive their children to succeed by putting undue pressure on them can potentially increase the levels of anxiety and depression in their children, impacting on their ability to succeed as tertiary learners. The participants reported consistently that the structure of NCEA, which is the National Certificate of Educational Achievement, which effectively is the last 3 years of the secondary schooling system in New Zealand, that it actually generates learners who have low levels of resilience as they're safeguarded to pass. So I've included a participant quote just because I think it demonstrates quite well how the NCEA system gives lots of opportunities. So I'll read that for you now. When I was working at university, we referred to the gap between NCEA and university study as the educational gulf, you know, like the Gulf of Mexico. It was huge. It is huge. I think firstly, young people are not being taught how to fail at school and how to fail well, is what I'm saying, and how to respond to failure, how to work through failure because they're not failing. They're not having the opportunities to fail. They're getting resubmissions and they're getting other opportunities. They just keep getting second chances or third chances. And there seems to be lots of ways to achieve, which I guess is good for those kids that are not highly academic, but you are not teaching them resilience. So in response to the third research question underpinning the study, what is the importance of developing academic resilience in tertiary learners? It's really important, as this research has showed that students have little or poor levels of resilience, also seem to be a feature of those who struggled with their poor mental health. So bolstering student resilience may also in turn aid in maintaining good mental health in students. A lack of resilience could also be a reason that learners don't always demonstrate help-seeking behaviour as well. And what I did find in conducting this research was that simply being a tertiary student can be a risk factor for poor mental health. I now know that poor mental health in learners is bigger than Mary, bigger than the School of Nursing, bigger than Otago Polytechnic. Mary is a national phenomenon. The responses from participants across both data sets were similar regionally and nationally. National participants were echoing the same experiences as the staff interviewed on campus at Otago Polytechnic. The ambulance is at the bottom of the cliff. The development of SafeMinded is now critical. I am now making a systems change within the organisation to keep Mary safe. So having an ambulance at the bottom of the cliff is something that is only really helpful after one is already injured or in trouble. So this is why the SafeMinded accreditation framework is critical. So there is a structure in place before students experience poor mental health secondary to academic study. So it's all about prevention and health promotion. So one solution is the SafeMinded mental health accreditation framework. So in response to the research question, how do we embed mental health and wellbeing in policy and strategy to develop a new way of thinking? SafeMinded is one such solution to this research question. So SafeMinded is the mental health accreditation framework that was developed as a result of my doctoral research. The SafeMinded title reflects that the mental health accreditation framework was primarily developed in education by the ED at the end, and it also represents the focus being on ensuring safe minds in the academic environment. So it is a framework that is specific to mental health. It is not a health and safety framework where often mental health gets categorised. There are 9 core values that underpin the framework, but the SafeMinded framework itself comprises of 5 sections. So each of these 5 sections has accreditation criteria that are grouped underneath, and all of the evaluative criteria listed under those 5 sections must be met by an organisation who are implementing the SafeMinded framework. The research study saw multiple themes generated from the data collection, and these themes, in conjunction with the practice gaps that were identified by research participants, were integral in developing the 5 sections and also the evaluative criteria within the SafeMinded framework. The Safe-Minded accreditation uses a maturity model as well that is designed to grow with the organisation. So the 5 sections in the Safe-Minded framework are measured against a maturity model, which is designed to increase the organisation's capability. So moving from just reporting on and identifying risks in a workplace to insisting you in analysing professional practice gaps, identifying trends, developing and adapting current policies, reflecting cultural sensitivity, taking ownership at all levels of the organisation, so from leadership down and grassroots up, and eventually developing new ways of thinking and demonstrating leadership in the sector. There is also bronze, silver and gold accreditation status that can be awarded when you meet the higher levels of the maturity model. So if the organisation meets medal status, a Safe-Minded badge is awarded, which can then be used on all marketing materials in the Safe-Minded licensing period. So there is an example here on the slide of a silver badge, and that is a way of demonstrating the organisation's visible commitment to mental health and wellbeing of learners and staff. So I think it is helpful to understand the process of accreditation, just to add some context for some upcoming slides. So in a nutshell, the Safe-Minded accreditation process firstly involves engaging with an organisation, and then a commitment is made by that organisation to undergo accreditation. So once the organisation has committed to the Safe-Minded accreditation, a process of information gathering is undergone. A Safe-Minded review is then conducted where an assessment of the organisation is completed using the Safe-Minded framework and the maturity model. Once the Safe-Minded review is completed, planning begins, where a comprehensive report is written for the organisation, and that report summarises the findings, including appropriate recommendations to help the mental health and wellbeing of the workforce or the student population to be enhanced. So once the organisation meets the framework criteria, the Safe-Minded accreditation is awarded, and the organisation is then committed to implementing those recommendations. And it's also important that ongoing evaluation and monitoring are provided as well to aid in moving up that maturity model to higher levels. So this is a very redacted version of the framework. I have added the 5 sections in the framework, but I've left out all of the evaluative criteria in the maturity model. And that's just around protecting the intellectual property of the Safe-Minded framework, because it is the only one of its kind in New Zealand currently. So the first section is lead, support, govern. And this section aims to ensure that mental health is a priority and that it is really visible in policy and strategy. It's about leadership, role modelling positive attitudes and having an understanding of mental health and mental ill health and how that affects staff and learners. The second section is engage, respond, advocate, refer. And this section ensures that effective pastoral care and support for students is accessible and that it's well resourced. The third section is external partnerships and engagement. External partnerships do have an influence on the mental health of learners, as many of our tertiary learners complete practicum in industry. And so if mental health and wellbeing is supported and promoted with our external partners, learners may be more likely to continue their chosen course of study and continue into their chosen field afterwards. This section also ensures the organisation refers learners where and when appropriate to external providers for specialist mental health support. Workforce education is the fourth section, and that's critical in stigma reduction. This section ensures that all the leadership team members are trained in basic mental health to lead by example. Also, that mental health training is available for all staff, but it also ensures that employees new to the organisation also have mental health training during an induction process. And the monitoring and evaluation of the Safe-Minded framework is required to demonstrate a commitment to the mental health and wellbeing of learners and staff also. How do I support Mary to swim? Supporting Mary and all students is through the implementation of the Safe-Minded framework. So the best way to describe the purpose of the framework is by using an analogy of a bucket. So you can see in the picture that the bucket is being filled by water at the top, and it has many holes allowing the water to leak out, but some of those holes in the bucket have tape across them. So that tape represents a temporary solution. The bucket itself represents good mental health and wellbeing of tertiary learners. So the glass filling the bucket at the top represents the inflows, or all the things that support and contribute to good mental health and wellbeing, and to keep the bucket full or maintain that good mental health. So these are things such as good support, resilience training, early intervention, workforce education, etc. There are also many holes in the bucket representing factors that deplete the good mental health and wellbeing, and these are the outflows. So the purpose of the safe-minded framework is to stem these flows or become more than a temporary solution, which is represented by the tape. The outflows consist of things such as pre-existing poor mental health, academic pressures, not seeking help, stigma, poor understanding of mental illness. So ongoing application of the safe-minded framework aims to replace the holes in the bucket, including those with tape, with welds, to ensure that it is a long-term solution. So the purpose of the framework is having a positive impact by keeping the bucket full, so to speak. So to aid in retention and success of tertiary learners and increase their capability while they're studying. There is no need for an ambulance. There is no cliff. Mary is safe. So at Otago Polytechnic, due to the implementation of the safe-minded framework, students should start to see positive change in the mental health support and awareness across the organisation. The safe-minded accreditation was undertaken in November 2022, so it's still very new at Otago Polytechnic. However, there are some changes that are already starting to be evident. So it has taken 6 years of commitment and hard work in developing and implementing a mental health specific framework into Otago Polytechnic. This photo was taken last week when we put the safe-minded seals onto the entrances of the main campus in Dunedin. So this is an amazing group of women who worked on the safe-minded mental health accreditation at Otago Polytechnic with me, and you can see here in the red circle the silver accreditation badge that was awarded to Otago Polytechnic. As this is a new initiative that's only been implemented into organisational structure since November last year, the evidence is just beginning to be apparent, but it is emerging. So as a direct response to the implementation of this framework, Otago Polytechnic has already had the following things happen just in the last few short months. So firstly, the leadership at Otago Polytechnic have committed to following through on the recommendations for future practice that were provided in the Safe-Minded Accreditation report. And engagement from leadership is really critical in the effective rollout of this mental health strategy. The leadership team at Otago Polytechnic have been really supportive and understand the need for this important work. And they've actually listened to the concerns raised by staff, and they have seen the trends in relation to an escalation in students presenting with poor mental health. They've been really proactive in integrating the safe-minded mental health accreditation as a solution. Student success at Otago Polytechnic, where learners can access mental health support, has meeting rooms that are in the hub, which is on the very first slide that I showed you with the lit up glass area at the bottom of the building, which is a very public and communal area. Some of the meeting rooms that they have there are completely transparent because they have glass walls, and this has been identified in the research as a barrier to students actually accessing support when they need it most. And distressed learners can feel really unsafe coming into an area that is really open and visible, and where there's a lack of anonymity. So one of the recommendations in the Safe-Minded report was to put frosting on these windows to aid in privacy for learners and then make mental health support more accessible for them. So these conversations have now taken place in our support service team, and frosting solutions are now underway for those glass meeting rooms. All of the leadership team members within the organisation are now required to undertake mental health training. And I think that's really important for leadership walking the talk and having a basic understanding of mental health and mental illness and how that applies to tertiary learners. all of our staff have access to good yarns, which is mental health training, and all of our leadership staff will now be undertaking the good yarns training course. The Safe-Minded Accreditation report has now been included in the national report for Te Pukenga as the primary mental health strategy that has been adopted by Otago Polytechnic. And research into compassionate withdrawals and statistical analysis will now be undertaken also to further understand the impact that poor mental health has on those learners who withdraw from their chosen course of study. So the Safe-Minded window sills are now in place on the entrances to our main campus, making our commitment to mental health and wellbeing really visible to everybody and demonstrating that Otago Polytechnic is a mental health aware and accredited environment for staff and learners. So I'm incredibly grateful for the opportunity to make this critical change for our tertiary learners. So the next steps are ongoing monitoring and evaluation of the Safe-Minded framework at Otago Polytechnic, integration of Safe-Minded across the national network of the tertiary providers would hopefully be the next step. I'm also going to undertake a research project 1 year post rollout to really understand what the evidence of impact of the framework is. National and international dissemination of the research. So not only today, but I'm presenting at the National Nurse Educators Conference in June on the Gold Coast in Australia. Getting Safe-Minded up as a business and conducting Safe-Minded accreditation across other areas than education will be a future project. So that's kind of the next steps for the framework. And we have now come to the end. So I'd like to thank everyone who has listened in to this presentation today. I appreciate you giving me your time. If anyone would like further information about the research project or the Safe-Minded framework, I would love to hear from you. And hopefully there's some future collaboration opportunities.
Well, thank you. On behalf of everybody on the call and GRNEN in general, we really appreciate you taking the time out of your morning to share this with us. Right now, if anyone has a question, you may feel free to go ahead and pop that into our Q&A and our chat feature. I know that Dr. Bartlett has shared her email address as well in the previous slide. So if anything were to come up down the road, you can connect with her directly. She is also a participant in the GRNEN website. So if you search for her in our member directory, you can connect with her that way as well. Let me see. One of the questions was, is the Safe-Minded framework exclusive to New Zealand and potentially Polytechnic, Otago Polytechnic, or is that something that it has the opportunity to be adapted and collaborated with outside of the country?
Absolutely. So it is, it has been designed in education, but it is designed to be adapted to literally any business anywhere, nationally and internationally. So there is absolutely opportunity for it to be used in other areas other than education and anywhere overseas as well. There isn't many frameworks in the world, I don't think, that exist like this. This is an accreditation framework, so it's not a mental health training package or anything like that. All of that workforce education sits within the framework, but it's actually a systems change across a whole organisation. So everybody sort of carries the flag for mental health. It's not just one person that's trying to wave the banner. So it does affect all aspects of an organisation, but it absolutely has been designed to be adapted to any workplace. Yeah.
Excellent. Okay. Well, if there isn't any other questions at this moment, we can go ahead and close off our webinar. Once again, thank you for joining us today. We always appreciate the time and attendance from our participants. And Dr. Bartlett, thank you so much. Oh, wait, we might have a question popping in. Before we head off, thank goodness I caught that. Can you comment on how this or something similar could be introduced to students before they reach tertiary education?
I absolutely think that introducing things like resilience training into secondary school education or even primary school education well before they come to tertiary study would be of a huge benefit for students, because what we are finding is that students do come into tertiary study with a lack of resilience, and part of that is around the secondary schooling system, as I said, in New Zealand. However, if there were strategies put in place prior to tertiary education, then I think that would have a big impact on reducing those numbers, I think, of students that do present with mental distress. And part of my work at the moment is actually talking to high schools and seeing if it is going to be able to be implemented earlier than tertiary study for exactly that reason. So a really good question, and yeah, hopefully it filters backwards as well. Yeah.
Any other questions? I'm going to make sure that we have the time to give. Okay. Well, as I said, you can always connect with Dr. Bartlett if you have trouble reaching her or cannot find her email address. You can always connect with us at info@grnen.org, and we will share that out with you. And we hope that there are advanced collaboration opportunities in the future, so that way we can continue to support nursing students. Looking forward to hearing how your next stage research comes after the implementation, and hopefully we can connect back and hear how that's been successful for you.
Absolutely. Thanks so much, Stacey.
Thank you. Thank you, everyone. Enjoy the rest of your day. Take care now. Bye-bye.
Bye.